Well, good evening, everyone, and thanks for joining us for this 13 Plus Fast Cast. I'm Ashley Bowerman. I hope y'all are all trying to stay as cool as possible in those triple-digit temperatures we have been seeing recently. But we appreciate you for joining us here on 13 Plus. We're going to go ahead and jump right into our story for this evening. So, it is Mental Health Awareness Month, and mental health concerns for military members is well known, but what may not be as well known is a relatively new program for those who serve our country to seek help. It's called the Brandon Act, and it was implemented last year and creates a process for military members to seek mental health help confidentially. Our national investigative team looked into how exactly it works and how it helps. Take a look.
They raised their hand to fight for our country.
But many of our military service members face an unseen battle. According to the Department of Defense, between 2016 and 2020, more than 450,000 active duty service members were diagnosed with at least one mental health disorder. The DoD's annual report on suicide tracks another significant concern. Nearly 500 service members took their own lives in 2022. 331 of those were active duty.
We should mention support through the Military Crisis Line is available 24 hours a day. Just dial 988 and then press 1.
We also want to go in depth on a new resource available for those in uniform. It's called the Brandon Act.
Reporter Heather Graff explains how the family behind it hopes to save lives and reduce the stigma of seeking help.
I know he's close.
We caught up with Terry and Patrick Caserta on one of many trips they've made to the nation's capital.
It provides me the strength to continue the work that we're doing.
Do you wear that every day?
Every day.
The military dog tag Terry wears around her neck, serving as a reminder of why they're here. A reminder of who they're fighting for.
He was amazing. He was always helping everybody.
He was the kindest, nicest person I've ever known, and he had a smile that made you want to smile.
Brandon Caserta was their beloved son, just 21 years old, when he took his own life while serving in the Navy. His parents say it happened as a result of relentless bullying and hazing within his unit.
He sacrificed himself to draw attention to his command.
How soon after his death did you decide we have to do something about this?
We sat down in August of 2018, which is a little less than 2 months after he died. We knew from his final words to us that he wanted us to do something. The only thing that we could do as parents is create a law to help save our service members.
The Casertas then set out to do just that, and upon hearing their story, Massachusetts Congressman and military veteran Seth Moulton sponsored a bill now known as the Brandon Act.
Part of the issue is that a lot of people on active duty don't get the help in a time of crisis that they need. The Brandon Act aims to change that, and it simply wouldn't have happened without their extraordinary advocacy in memory of their son.
The legislation is designed to improve the process by which a member of the armed forces may be referred for a mental health evaluation. It requires a referral be made as soon as someone self-reports, while also allowing service members to seek help confidentially and, if necessary, outside the chain of command, at any time, for any reason.
If they choose to let their command know, that's fine. Their command can't retaliate against them. It's to keep people healthy, because mental health is health, period.
For Patrick and Terry, it's painfully personal, but experts say mental health struggles in the U.S. military are a pervasive problem. The Cost of War Project at Brown University estimates about 30,000 active duty personnel and veterans who served post 9/11 have died by suicide. That's at least 4 times the amount killed in combat during that same era.
It's excruciating.
Scary statistics that made this timeline excruciating as well. The Brandon Act was first introduced in June 2020 and signed into law in December 2021. But it would be 16 more months before the Department of Defense finally announced the policy's implementation in May 2023.
How frustrating was that delay?
We didn't understand. We could not understand why it wasn't being implemented on the DoD level.
And do you believe that cost lives?
Oh, absolutely.
People are dying left and right, literally.
Military health system officials addressed the delay in a statement to Investigate TV Plus, writing in part, "Nothing is more important to Department of Defense leadership than taking care of our people and ensuring their mental and physical health and well-being. The implementation of any new policy can be complex, and while we understand the urgency, we are committed to getting this right."
It's a very significant shift.
Dr. M. David Rudd is a psychologist at the University of Memphis who's spent years studying mental health and suicide in the military. And though he feels the Brandon Act is a big step in the right direction, Rudd says its implementation illustrates just how slowly the system moves.
It will actually help if it's done appropriately. If it's implemented and people are genuinely allowed to pursue care in a confidential environment and they're given the time off, they're given the resources that they need to pursue care, then it'll be helpful. It'll be effective.
How do you think the military can ensure that that happens?
Well, there are only a couple of ways. People that are in authority positions respond to what you evaluate. If you make this a part of how local leaders are evaluated and assessed in terms of their effectiveness, they'll respond. If you don't, they're likely not to respond.
My message to them is to continue to expect oversight from this congressman. Because in the same way that I pushed you month after month to actually get it done, DoD, now I'm going to make sure it's actually working.
The DoD has said all service members will receive annual training, and in response to our questions, officials said it is mandatory for commanders and supervisors to honor a Brandon Act request, adding non-compliance will have consequences.
We're going to hold the military accountable, but we've got their commitment. They're going to hold themselves accountable. That's very important.
Still, the Casertas hope to further expand the law that bears their son's name, which is why we found them back on Capitol Hill in late 2023.
We want a poster in every workspace. We want to add some other elements to it to enforce it more.
A mom and dad on a mission.
I could just hear him say, I knew you guys would push it through and see it through. I also know that you would never let me down.
And in their advocacy, Brandon lives on.
His legacy is intact, and it means a lot to us, and we know it means a lot to him.
The Casertas say they want to ensure troops know their rights under the Brandon Act. They hope to travel the country, visiting military bases and communities to spread that message. They've also started a foundation in Brandon's honor. You can learn more at thebrandоnact.org. And again, if you or someone you know is struggling, the National Suicide and Crisis Lifeline is available right now. Just dial 988. Service members and veterans can then press 1 to be connected directly to the Military Crisis Line.
Well, that is going to do it for our 13 Plus this evening. As always, we appreciate you for tuning in here online. We do stream live here on Facebook as well as on our Facebook page. So we leave you here this evening with a live look outside as the sun sets on this warm day today, and we are expecting to see those triple digits over the next several days, so take precautions and stay safe out there. Of course, we will have more news headlines and sports and weather coming up tonight at 9 and 10. We'll see you then. Have a lovely night.